Hello everyone, my name is Ellie Hazlett, and I'll be your moderator for the Patient and Family panel. I'm a rare disease patient myself, having been diagnosed with complex regional pain syndrome, hypermobility syndrome, which is clinically analogous to hypermobility Ehlers-Danlos syndrome, as well as a form of dysautonomia called postural orthostatic tachycardia syndrome. Ever since receiving a life-saving treatment in 2017, I've had a passion to share my story, and those of others like me, to raise awareness of the incredible strength of the rare disease community. As such, I am so excited to help our panelists share their experiences with you today. If you've been with us all week, you may have realized that one of the main goals of Rare Disease Network is to highlight commonalities across the many stories of rare disease. As you listen to our panelists today, see if you can pick up on some of those common themes. And if you find yourself connecting or relating to one of our panelists, keep their name in mind, as we'll have a chance for you to network with them during a live Q&A session on Saturday morning at 10 a.m. So with that, let's meet our panelists.
My name is Savannah Taylor, and my brother's name is Jonah. He is diagnosed with Marshall-Smith syndrome, which only affects less than 50 people in the world, and it impacts his bone growth as well as his cognition and respiratory system.
My name is Olivia Cerny. My friends call me Liv. I am a patient who is diagnosed with Klein-Levin syndrome. It is a rare neurological disorder that is characterized by reoccurring episodes. For me, I am in an episode for about a week. So within an episode, I will sleep for 18 to 22 hours per day. And when I am sort of like awake, I feel like I'm still dreaming. I have had experiences with hallucinations. I get very irritated. I act childlike. I've even had some instances at throwing things at my sisters, which is interesting. I have an increased sexual drive and also excessive eating. And my first episode started in 2016. And since then, I have had 6 episodes within the span of 2 years. And it was in 2018 when I had my last episode. So it's been 3 years now, which is one of the great things about KLS, if there is anything great about it, where we do typically grow out of it.
My name is Amy Colthorpe, and I am 45 years old, and I'm the mother of 2 children, and we were all born with a mutation in our P53 gene, and so that gene's job is to decide whether or not your cells are going to stop replicating or not. And so we have a greater predisposition to multiple different types of cancers at pretty much any age. So starting from the day you're born and moving ahead. So, and then the total name of it is Lee-Fermini.
I'm Mike Coleman.
I'm Rebecca Coleman, and our Gabby is diagnosed with a TBR1 genetic variant, which produces a different type of brain structure in a lot of people, and in many cases, a diagnosis of autism, which she was diagnosed with in August of 2020.
So I'm Melissa Case, and my son's Wyatt. He has total colonic Hirschsprung's disease. He has Crohn's disease and severe sleep apnea. His genetic variant is FOX2B, and he's an NPARM.
My name's Jordan Covey, and this is my husband, Nick. Our son, Gideon, is 7, and he was born with autosomal recessive polycystic kidney disease, and it has congenital hepatic fibrosis. It's shortened to ARPKD/CHF. So basically, his kidneys developed a ton of tiny little microcysts until they stopped working. So he had a kidney transplant in June of 2019. And unfortunately, that transplant failed. And he developed a rare cancer that went with it. And so he's in remission now. But otherwise, now we're on dialysis and plugging along.
Tell us a fun fact about yourself, sibling, or child.
So I've been married for 18 years, and I work as an occupational therapist, and I work mainly with breast cancer patients. We have 2 cats, and I have a daughter who's 15 and a son who's 12.
I have a dream of renovating an RV someday, or like a house. That's just been on my bucket list. And I also love finding furniture on the side of the road and like refurbishing it. I find it so much fun, and like getting to see like the beauty of something again.
Well, Jonah was adopted from the foster care system, and he's really into cars. So he's developmentally around the age of a 5-year-old, when he's physically 12. But when it comes to his knowledge on cars, he's like 60.
His favorite band is the Beatles.
She's 4, so favorite hobby's tough. She loves to play dress up. She's quite
High
the girly
heels.
girl.
Yeah.
Yeah.
Tutu she puts on. Yeah. I mean, overall, her personality is very, bubbly, very friendly, and she's also very hardworking.
I like candy.
You like candy?
How has your rare disease shaped or changed your worldview?
It's allowed me to, I guess, realize in life there are so many unknowns. And sometimes you just can't prevent it, which can be really hard. But I feel like that has strengthened my faith with God, and trust that He's going to get me through this, and that I have a support group who is going to be by my side through it all. I think it made me realize there's like not only unknowns within like through your health, but also through like relationships and education and like life in general.
Yeah, I feel like having a sibling with a rare disease has changed my worldview in a couple ways. For the negative side of it, I have been more aware of ableism and hate speech against people with disabilities. And I feel like that hyper awareness has really made me see some of the bad sides of the world. But on the other side, it has opened me up to the special needs community, which is a very happy community to me. Like a lot of people that I've interacted with special needs are just very happy and smiley and super bubbly all the time. And so I've definitely seen two different sides of the world, like, because of this, and I think that's pretty unique.
I've known that cancer was going to touch our lives since I was born. My dad passed away when I was 5 from stomach cancer, and his dad passed away in his 40s. Both of my aunts had breast cancer in their 20s, and so we've always talked about cancer in our family. It's something that my mom has really, from as soon as my dad was diagnosed, she worried about us kids, my brother and I, potentially having this be some kind of genetic thing. So it's really been a part of my life without knowing it was a part of my life since I was 5. And then when I was 18, I met with a genetic counselor who decided that definitely our family was at risk, but they didn't know what to test us for yet. So they didn't offer us any testing at that time. And then when I was 27, I was diagnosed with breast cancer the first time. And so I still didn't know my genetic makeup at that point. I just knew that I was a young person with breast cancer. And so it wasn't until 2013 or 14 that we actually figured out the genetic makeup, and actually knew what it was and put a title with it. And so I actually think that the title was helpful. Knowing and putting a name to it was helpful. So really, I feel like it hasn't changed my worldview. It shaped my worldview. So I don't think that it changed mine. I think it just brought clarity to my worldview.
Because her rare disease, the consequences that we live with are the autism and the fact she's differently wired. It's more respecting the space of kids that are wired different. That's more a conscious part of who we are. It's more seeing someone out in public and knowing, oh, that child has sensory issues, they're not meaning to melt down, and that kind of thing. It's given us a bigger sensitivity around that.
Yeah, so I mean, it's definitely challenges, but we've seen obviously other parents dealing with a lot worse, so it's we're thankful for that aspect as well.
Gabby's rare, I think, only in the sense that not everybody's gotten genetically screened that has autism, and so maybe there are a lot of TBR 1 variants out there that we didn't know about, right?
My husband and I are probably a little more realist than we were 10 years ago. I just always want to know what could be down the road, I guess. I don't want to always hear the best case scenario. I don't want to always hear the worst case scenario. I kind of want to hear all of the scenarios too. I need an average scenario kind of deal, I guess. But if we were just like, everything's going to work all the time, then I feel like you're going to be a little let down, because even the best treatments and the best doctors do not have 100% success rate.
Patience. Oh my gosh.
Lots of patience.
We have so much more patience now with everyone. And we like to say that we've always been patient and kind, but we never really realized how much people are dealing with in the background. So we only get to see the surface of people. And it's really helped us to be patient with other people in the world and just like understanding of what other people are going through.
What is something you have struggled with on your journey, and one thing that helped you at that time?
Me. You. Yes, you were great.
So Jonah has had to have many surgeries because of his disability. And one of his worst surgeries was a jaw distraction where they moved the jaw out and up. And it took a good 6 months to fully recover from that surgery. And it's been very helpful to have the Marshall-Smith syndrome parent group, or parent or caregiver group, I should say, because many of them have already been through that. The oldest person with Marshall-Smith syndrome is, I believe, close to 40 years old now. So it's helpful to have people who have already experienced this same kind of thing.
Yeah. So because of going into an episode, I will miss about a week of school. It can be more than a week of school, actually. When I'm in an episode, my episodes last for a little over a week, so I definitely can't go to school. I can't function. And then after I get out of an episode, I'm extremely exhausted and can barely even watch a TV show without feeling drained. And so that's been really hard because I've missed so much school. I've missed seasons of tennis and sports. And just hanging out with friends. So that's definitely been a struggle. But I think what was helpful was just being open to people and saying hey, today I'm just really exhausted. I don't think I can hang out. And even just being open with my teachers. I found that to be extremely helpful, and they seem to be helpful in that sort of way.
My son was 5 and my daughter was 7 when I had them tested, and I think that was the hardest thing, because getting their results, they'll never be able to not know whether or not they had that gene or not, where I could decide whether or not I wanted to know. And so that part initially really bothered me, that they weren't ever going to be able to unknow that. However, when my son was 7, so 2 years after that, he was diagnosed with cancer. And so we would have figured that out. Now he would have known anyway. So that guilt is a lot less today than it was back when we first when I was first making those decisions for our children and getting them tested. So, and they both ended up testing positive. So now, it has a lot of ramifications for them, and they're going to start things a lot earlier than what I did. And so that part I've always, and probably always will, feel somewhat guilty for.
I would say one of the things I struggled with was even doing the deeper dive of testing, because I was like, well, she doesn't have Fragile X syndrome, which is what the first layer tests for. All her chromosomes are in order. What's the second level of testing really going to give us? I'm glad we did it, because reading the paper and the literature on folks that have this specific type of gene variant gives me it was like, oh, that symptom's Gabby. Oh, that symptom's Gabby. Oh, she's been diagnosed with this before from her neurologist. So it was like, finally, she makes sense on the spectrum. Finally, she makes sense as a human, not as a human being, but like as a patient or as someone. There's a diagnosis that fits.
Well, I'd say from an external environment, what was challenging was obviously COVID, because we had her in a pre-K program. I mean, obviously everyone's been affected, but tough thing is obviously for her, there's no remote learning. It's classroom or nothing. So, we were making pretty good progress in her pre-K program, up into February a year ago. And then it was just like everything got shut down. We feel like we lost several months. And what's good about that class is not only the structure, but she also has peers, because she doesn't really, like the ABA therapy, the speech therapy, and the occupational therapy, it's individual. So that was the one place where she had other peers. And so that was, very harmful, I think, to her development.
Honestly, all of her physicians have been great. They've answered all of our questions. It doesn't change the course we're going to follow for autism so much, but it helps us define where Gabby fits on that spectrum. It confirmed that maybe we were doing the right things without knowing why we were doing the right things.
You're on Facebook and you join like all the groups, right? And as a first-time mom, that was a huge mistake for me personally, because I got super overwhelmed by like just all this information coming at me. And so you're a new mom, and then dealing with the disease on top of that, it was just overwhelming. And then even coming home off of that, you just are reading so many things of, what can happen now when he's this age. And every kid is different. Every case is different. And those groups are great to a point. I just got like sucked down into a rabbit hole of kind of despair at the very beginning. But we had a really great hospital care. Like, we've been really, really lucky with fantastic medical care. And we live by a lot of families. So for us, having that kind of support has been really good. And then as things progress, going back into those groups with slightly more experienced eyes was better, but don't have it on your timeline. Just go back and peek in when you, if there's something interesting this week, or maybe there's not. I can ask a question when I need to, but it's not showing up on my timeline every day. That can be, that can make it overwhelming too, if you're just constantly seeing everybody else's stuff going on. But if you're just there when you need that support, that I think is a better way to approach it than seeing it all kind of in your face all the time.
I think the biggest thing we struggled with was in the beginning, and that was accepting that it was our family's journey. So we always said, why are we dealing with this? Why me? Why are we doing?
Why us?
Why us? Why Gideon? And then another mom in the ARP Kitty community, instead of phrasing it saying, why me, she phrased it as, why not me? What makes us so special that we don't have to deal with anything? And so that was really eye-opening for us. And that was the hardest thing for us to get over, is just accepting that this is what he's going to have to deal with the rest of his life. And his normal is different than everyone else, and that's okay. Yes. We call it his normal with a little bit of extra, because he's normal just like everyone else.
Is there anything good about having a rare disease?
Yeah, if I had never had KLS, I wouldn't have been in the hospital. And if I had never been in the hospital, I would have never met some incredible nurses. And it was through that experience that I actually wanted to become a nurse. And so that was a huge part of my journey. Before that, I was disgusted by the human body. But then through this experience, I was so fascinated by what they were doing with me and what their experience as a nurse was. And yeah. And then I would also say it has brought me so much closer to my family, because it hasn't just affected me, but it's affected my parents and my sisters. And so that's been an incredible blessing.
Yeah, I very strongly believe that my brother's disability has made him who he is today. And I love him as if he's my own child. And so, I wouldn't change anything about him. And so I definitely am almost thankful for his rare disease, because I know that he would not be who he is without it.
There's like 420 families that have this same gene. And early on, we couldn't connect because there's no way to connect everybody. But through the power of Facebook, they've been able to create a huge community of people with the gene and then family members who care for people with the gene. And we've been able to meet all kinds of people from different countries, from different states, and we've been able to stay connected through groups on Facebook. And we actually even had a retreat for people with the same gene like 2 years ago, and we got to meet people in the flesh. And now we still meet on Zoom calls every couple of weeks. We'll gather, and the kids will go in one room and hang out, and we'll hang out from our living room. And that part would never have been possible, and I wouldn't know those people without this mutation. So that to me has been a huge blessing. It takes something that's super hard and makes it good. The hard part is that a lot of us have the gene, and so one of us is usually cancering at some point, and a lot of people end up passing away that you get to know and love as well. So I love that group, but then it also is hard because of just the dynamics of it all. But we can bounce ideas off each other. We can bounce treatment options off each other. We all have to do a full body MRI scan. We all have to get colonoscopies all the time. And so we can make jokes about, we all share like what's the worst MRI you've ever had. Like not many people can go around and talk about those things. So to have a community where you can share the frustrations has been really, really beneficial.
I mean, I wouldn't trade him for the world, obviously. We have met some, better not, he says. We have met some incredible people along the way, as far as at our appointments or, in our medical team. In the group, I've met some friends that have been really good.
You come to appreciate science a lot more and how far we've come. I wouldn't have known the answer 20 years ago. Gabby would have just had autism. Now I know she has this genetic variant that has these types of symptoms, and I have my answers. The plus of it is because she does have this rare disease that led to autism, she's going to be working harder in her life, but that's going to yield rewards for her later.
Raising a kid with a rare disease really makes you appreciate the time you have with your family, and it makes it so that you value it so much more. And when Gideon was first diagnosed with cancer, he had a really long hospital stay. And so we were released, and then a few days later, the entire state went on lockdown. And that really brought us together and gave us 100% uninterrupted family time. And so that has been a beautiful thing for us. Our marriage has even been stronger with all of this. We thought, you hear your kid has a medical condition, marriages fall apart. Yeah. And for us, we've really leaned on each other. Together. Yeah, now we're really stuck with each other.
How has your rare disease affected the way you participate in your community?
I would say it doesn't really affect me when I'm outside of an episode. But when I am in one, my whole life turns upside down and basically just stops. So that has a huge impact on my life. I have found a KLS community. In 2018, I went to a national convention for I'm not exactly sure how to pronounce it. It's the National Convention for KLS or something. It was in California, and it was the first time that I ever got to meet people with my disease. Something that I didn't mention is there's only 1,000 people in the world who are diagnosed with KLS, so it's very rare to ever meet anyone, and so it was just such a unique experience to meet people and to know that they just understand without having to explain what you were going through, and some of the things that I had a hard time articulating with people who don't have KLS, they just knew right away. They're no way, I have that too. So that was just a really incredible experience, and so yeah, I'm still talking with a couple of those people.
Right the day that I was diagnosed, I just went online and started researching all that I could. And so I actually found that community fairly early on. And they were having a conference. So they have a consortium where all of the scientists get together and talk about this gene. And they invite family members to come and join in. It's really uplifting to know that people are working on trying to help our specific needs.
I started volunteering for these different organizations that work with people with special needs, be that in my church or in just other organizations in town. And I have actually chosen my career path as a speech pathologist because of my brother and just seeing how speech pathologists helped him communicate with us. And so that made me want to then pursue the same career, and my parents have been very active in the special needs community. My mom has a small group of all moms with kids with disabilities, and we've been pretty active with the Marshall Smith specific community, which there are only 6 or 7 people in America with Marshall Smith syndrome. And so, but it's been pretty cool because people from Germany have actually reached out to us because there's been more research done in Germany than there has been here. So, yeah, we've been pretty involved with that community.
It's let me join parenting groups online where I'm getting answers on how to deal with some of her behaviors and just helping to guide her.
There's actually another boy in our community who has not exactly the same condition, but a very similar situation to ours. So to have 2 boys in the same grade, actually, it's kind of interesting, the community kind of embraces them and does what they can to really take care of their own. I certainly don't feel like we're ever excluded in any way. Our school goes above and beyond to make sure that there's never any issues in that respect.
So we live in a really rural community, and for example, I think we're the only ones in our school district that has had a kidney transplant.
Any transplant
For that matter. My parents are educators for our local school district. And talking with my mom, she's like, I've never taught a student that has had a kidney transplant. So our mission has been about education and making sure people realize things like a transplant isn't a cure, it's just a treatment, and that we're going to have to keep continuing on. So that's been a big part of what we do in our community. Educate, awareness always, which is what we're doing. But community-wise, we really reach out further. So we talk more with, I've got friends in South Dakota and Arizona within the ARPKD community, and that's where we go more than anything, because there really isn't anyone in our area that understands what we're dealing with.
What can your local community or those watching right now do to better support you or your family?
For me, just ask questions. I love talking about my rare disease and spreading the word about it, because I know through awareness that people will be able to get diagnosed faster, or they don't have to go through this unknown of being misdiagnosed several times like I had, and getting put on medications that actually will harm you rather than help you. Just ask questions. I'm an open book.
You can go 15 years and not have any issue, and then you could have, 5 cancers within a year, or even at the same time. I'm pretty open with it with everybody. I also am very passionate about cancer and cancer survivorship and how hard that is. There isn't always the right thing to do, because it is hard to understand. It's taken me years to figure out how to process where I'm at with everything. So, and then for my kids as well.
I guess just having an understanding, because my brother, he looks like he's 6 years old. And so if we're in a store and if he wants to buy something, but my mom tells him no, he sometimes throws a fit. And to people, it looks like a typical 6-year-old just throwing a fit. And we'll get these stares from people, or glares that they're annoyed that this kid should be behaving when he's not. So I think it's important to not assume anything when you see something like that, and just try to be understanding. And
I don't know if there's anything they could do locally besides just being more understanding. We've had a lot of people struggle to understand that even though they can't see what's wrong, that there really is something wrong. We've had some people in the school district actually say, well, it's just his kidney. And it's like, oh my goodness, it's
more than
so much more than that, because he's very intelligent. And so when you talk to him, you don't notice anything about him besides the fact that he's got what we call his kidney belly. It's a big old belly. So understanding, being more understanding and empathetic to what people are dealing with.
When you go to not necessarily sometimes your primary physician, but like your local hospital, not your specialist, that they're just not well versed in what your condition is. And I understand, some conditions are super, you've never heard of them ever, but then to not trust that the parent knows what they're talking about. That's been, I would say, our one kind of problem, is that if we've ever had to come to our local emergency room, that a couple times we've had an instance where a doctor or two have kind of questioned, what does he really need to hear? And so if we could just have that support as parents, no, we're not a medical provider, but we've been taking care of this disease for 6 months, 5 years, 10 years, 15, and so maybe we have the specialty to just know our own child.
In general, don't assume every kid's coming from the same place. Some of them may look normal, but they're overcoming huge challenges in their mind and their feelings and how they perceive the world, or huge physical challenges you may not see. So just kindness matters. If I discipline my kid differently than what you're expecting because they have a meltdown in public, I'm doing the best I can, the best way I know how for what I've got.
What is the one thing you most want people to understand about your rare disease?
I would say my rare disease does not define me, but it has helped shape me who I am today. And so when you are talking to someone who has rare disease, don't make the rare disease be like their identity. Like they are our person. The rare disease does not define them.
Yeah, it's very difficult to have a sibling with a rare disease. My brother actually has a feeding tube, and my mom blends all of his meals for him. And so it's a lot of work for her because she's just in the kitchen doing that pretty much all day, every day, just to make sure that he has enough meals. And then he's very high maintenance. He requires supervision almost all the time, and he can be very defiant as well. And so, like, everyone in our family has had to step up and kind of take on a role of a caregiver for him. And honestly, like, when we first started fostering him, I was only 12 years old, and so I had to grow up very quickly. I was also the youngest sibling, so I had never had any sort of responsibility to that level, at least before. And so it really did require, me to quickly grow up and become more responsible, and, it's definitely not an easy task, but it's definitely worth it, is what I would say.
There's a lot of rare diseases out there, and some are really on the outward where you can see it just by looking at somebody, but a lot of times it's not something that you can just see as an outward appearance, and really showing compassion for everyone, because you don't know who's going through what at any given time. And, I think cancer is a big one. I think people understand cancer and they're afraid of it. They are appropriately afraid of it and appropriately can dole out compassion. But I think there's a lot of rare diseases that you can't see. And really trying to, when you learn of someone's rare disease, I was really trying to learn about it and understand it on a deeper level rather than just shying away. I think we have a tendency to want to shy away from people who look different than us or act different or have different things that they're going through. So really trying as a human, helping out another human, just really trying to understand kind of where that family or that person might be coming from.
There are lots of challenges, but every single one of them are worth it. We certainly are lucky in that, looking at Wyatt, he is a perfectly healthy boy just to look at him. And most people see him and don't know anything. They're none the wiser to just look at him. And so in that respect, we're lucky.
We'll have its ups and downs.
Yeah.
Some days are better than others.
The biggest thing that we've strived to do is celebrate every victory. And so when Gideon's transplant failed, it was due to a virus that woke up, the BK virus. And in the beginning, it was at 5 million copies in his system. And when it got below 1 million, we celebrated with pizza. And then when it got below 1,000, we may have cried a little bit, and then we celebrated with more pizza because that's his favorite. So we just make a point that even if it's a really small thing to accomplish, it's a big deal. And so that has been the best thing that we've been able to do. And we phrase it as celebrating every victory and embracing the suck. Because everybody has sucking, and it is what it is. You just have to embrace it.
When somebody tells you your child is different, that's a very scary sentence to receive from a clinician to a parent. And I think a lot of doctors have that conversation very well, not to alarm parents, but that should definitely become just part of clinical training. How you deliver that news when a child is young matters. To any parent that's out there wondering, my child behaves differently, it seems like my kiddo is wired differently, but I don't know why. What happened to make them this way? I would say keep knocking on doors till you get your answer.
Yeah, I mean, with science, there's a lot of testing out there that's available to kind of nail down, just like in our case, and being able to determine the best course of action to proceed. I mean, and even in the future, there might be like gene therapy, and not just for this, but I'm saying even in general for other genetic abnormalities. So it's always, good to use the science and investigate.
And now this opens up the door, at least for us, for Gabby to become part of other studies, and we can maybe, see other results of people that have the variant, the genetic variant that she has, and just be able to be like, okay, they're struggling with the same things we're struggling with. So it gets you not only to a place of answers to keep going, but maybe even a place of community.
Thank you so much for joining us today. Now that you've heard from our panelists, here's your opportunity to go deeper. On Saturday at 10 a.m., we'll be having a live Q&A session with each of our panelists. So if you have additional questions or you want to connect with a particular panelist, make sure to join us. We'll see you there.